country may be about to participate in a great big MAGA science experiment. Donald Trump rounding out his picks to lead the federal government's top public health agencies last night, choosing Dr. Jay Bhattacharya to lead the National Institutes of Health, the nation's leading medical research agency, an institution that most of the time works quietly behind the scenes, but is an incredibly important part of our federal government. The NIH has a $48 billion budget and is the single largest public funder of biomedical research in the world. The NIH is behind some of the biggest scientific breakthroughs of the 20th century, cracking the genetic code, for instance, vaccines for hepatitis and HPV, and even those mRNA vaccines that made it possible for the world to emerge from the COVID-19 pandemic. Work done by the NIH touches practically every aspect of our lives. Research it supports has led to clean air guidelines and the nutrition facts that are on just about everything we eat, all the food. To lead the NIH, Donald Trump has chosen a man who made a name for himself by pushing a policy that experts blasted as unscientific and feared would lead to millions of deaths. NBC News reports this, quote, Bhattacharya gained national attention in October of 2020 when he co-wrote the Great Barrington Declaration, an open letter calling on public health officials to roll back COVID lockdowns. The proposal, released before vaccines became available, advocated for a concept called herd immunity, which refers to a level at which a large enough share of a population has been exposed to an infectious disease that it is unlikely to keep spreading. The idea of herd immunity was met with furious pushback by medical experts.
If you let infections rip, as it were, and say, let everybody get infected that's going to be able to be getting infected, and then we'll have herd immunity, quite frankly, that is nonsense. And anybody who knows anything about epidemiology will tell you that that is nonsense and very dangerous. Because what will happen is that if you do that, by the time you get to herd immunity, you will have killed a lot of people that would have been avoidable.
These people just, I think they don't know what they're talking about. They really do believe that the idea here is let's get everybody infected. And, you know, we have robust debates about whether 1 or 2 or 6 million people would die from a herd immunity approach. But everybody agrees it would be awful. It is a terrible strategy.
So that guy, herd immunity guy, well, even at the time, he got Donald Trump's attention. Watch.
It would go away without the vaccine, George, but it's going to go away a lot faster.
It would go away without the vaccine?
Sure, over a period of time. Sure, with time it goes.
And many deaths.
And you'll develop herd, like a herd mentality. It's going to be herd developed, and that's going to happen. That will all happen. But with the vaccine, I think it will go away very quickly.
We believe what he meant to say was herd immunity, not the herd mentality, we think. And just a month after he made those comments, 11 days after Trump went to Walter Reed Hospital for COVID, where his own situation, his own COVID infection was so serious, he had to receive supplemental oxygen treatments, the White House officially embraced the Great Barrington Declaration. Take Bhattacharya's nomination at NIH, take the anti-vaxxer and conspiracy theorist known around the world, RFK, at the head of HHS, and then take Dr. Oz, who is known in the past to have peddled unproven health treatments to his viewers and fans, to be the Centers for Medicare and Medicaid Services Administrator, and a picture emerges of a pretty radical departure when it comes to public health, not just from what we have now under the Biden administration, but from the first Trump administration as well. An op-ed in the New York Times puts it like this, quote, Trump left office amid a virulent backlash against scientific and medical expertise, marked by sharp declines in public trust, especially among Republicans. The administration that began Operation Warp Speed to develop vaccines to defeat the worst pandemic in a century ended in an epidemic of vaccine skepticism. What we now have is a, quote, emergent MAGA science policy agenda driven by skepticism and anti-elitism, blends familiar conservative and libertarian ideas with the suspicion of expert power, once more associated with the left. The result is a uniquely American brand of populism that has the potential to fundamentally reshape national politics. Donald Trump choosing conspiracy theorists and skeptics of public health expertise in science and what it means for all of us in the second Trump presidency is where we start today with some of our favorite experts and friends. Critical care physician, professor of pediatrics, and pediatric disaster response expert, Dr. Michael Anderson is here. Also joining us, Washington Post national health reporter Dan Diamond is here with me at the table, president of the National Action Network, host of Politics Nation right here on MSNBC. The Reverend Al Sharpton is here. Dr. Anderson, I'm first going to ask you, of all of these picks, which one worries you the most and why?
Yeah, I think the tension level continues to rise amongst physicians and public health officials, amongst my friends and colleagues that work in the federal government, and amongst families. We can talk about that. I am so proud, and you did such a nice summary of the NIH and the very quiet work they do. And I was smiling from ear to ear when you talked about mRNA-based vaccines. Those helped save millions of lives in this country and across the world. And the mRNA-based vaccine will save lives in the future because despite some people saying, give the infectious disease researchers 4 years off, there are going to be other pandemics. There's going to be other outbreaks. So the NIH is so vital. We need a leader that is visionary, that can help us move forward, not litigate things from the past, that can see the threats coming, and in a very self-centered way as a pediatric advocate, knows that the needs of children have to be front and center as we think about NIH funding and NIH programs. So I'm just concerned that we need to have a very scientifically rigorous pick to lead the NIH.
Dr. Anderson, I want to ask you about, I feel like the job is different now, right? I mean, I think you were here to help our viewers make sense of the information Dr. Fauci was offering when he was in the government and Trump was president, because Trump sometimes contradicted it, but Fauci was there. Dr. Jha, also a familiar face to our viewers, was in the Biden administration. And it was a matter of, I think, making sure people knew what we were supposed to do now, right? 4 years into COVID. I want to ask you a serious question about what happens if people simply hear vaccines as a two sides argument, right? I have a 1-year-old, so we're at the pediatrician every month for shots. If suddenly the whole country hears a fire hose of two sides of pediatric vaccines, what happens?
Yeah, I worry about that every day, and I keep falling back on my terrific friends that are pediatricians and public health officials, mostly in the private sector, right? And I hear from my friends all the time that office visits now, there's so much misinformation out there. There's so much garbage information out there. Vaccines save lives. They're safe and effective. And as I've said before, I have enough gray hair to remember losing patients from varicella or from Haemophilus influenza B, which have been wiped out mostly because of vaccines. So to answer your question, I think that void is going to need to be filled by pediatricians, by the American Academy of Pediatrics, by folks coming on your program and spreading what's called science and spreading the truth. The thing I worry about, that once again we've talked about, these medical professionals, nurses, nurse practitioners, doctors, they're bloody stretched as it is right now, just taking care of patients, and now having to carry the torch of being the information bearers for the country. That's almost too much to think about.